53-year-old Ken Brown is in the business of making signs.
I'm originally from Jamaica, so this is something that I've been doing since I was a young boy in Jamaica at the age 14. I started doing this, and I bring it right over here to the state, and still do it as a hobby, and still made a little change some way, somehow out of it too.
Ken's hobby became more of a challenge because of pain he was experiencing in his left hand.
This is something that's been happening for, like I said, a long time, years ago. Probably when I was in around 40, and I totally ignored it.
Ken describes how the pain became debilitating.
I feel like tingling in my fingers. There's times when I have to flash my fingers, just try to get some comfort. And then it started getting worse at night when I'm sleeping. That's when it's really getting real. That's when I really realized there's something seriously going on here.
After many sleepless nights, Ken made an appointment with his family doctor.
He said to me that, he's gonna have to send me to see a surgeon about this, because it has to be carpal tunnel going on here. So he referred me to Dr. Thompson over there at St. Joseph Medical, Penn State.
Ken was prepared when he went to Penn State Health St. Joseph Medical Center.
He also had come with an electric test, an EMG nerve conduction test, which looks at the health of the nerves as they go through the hand. And in his circumstance, he had carpal tunnel syndrome. So he had pressure on that median nerve that goes to the palm of the hand, and that was what was causing his symptoms.
Then he realized that the left hand, pretty much sooner or later, I would not be able to have any grip, because it's real bad. The nerve is real bad. He tested the nerve in both hands, and my left hand nerve was pretty much almost gone. There's no feeling in it, pretty much.
He had already tried some anti-inflammatory medication and some non-operative care, and the fact that he was becoming somewhat miserable without sleep, we recommended he undergo surgery.
I just need some comfort. And whatever it takes for me to get that comfort, I'm gonna have to do whatever it takes.
It's a fairly small surgery. It's outpatient surgery where just about an inch or 3/4 of an inch incision is made in the palm surface of the hand. And through that incision, we just go down and find this band that's sitting on top of the nerve or compressing the nerve, and we open that band and it releases the carpal tunnel, and then that takes the pressure off the nerve and usually fixes the problem.
Dr. Thompson never fails me. Everything that man said to me based on my surgery was right on point. He's a pro. He knows exactly what he was saying, and he knows exactly what he was doing.
We're always happy if the patients are doing well, especially if we've done an operation, and our whole reason for being, I guess, is to do surgery to try to help people to get them out of pain and get back to their lives.
Ken is now pain-free and back to doing his favorite hobby.
Well, it makes me feel good, to know that, where I'm coming from with this issue to where I'm at today, it makes me feel good to know that, Dr. Thompson doing a great job, and, to help me get this relief this pain that I was feeling all these years.